Kasoa Polyclinic are raising concerns over the lack of a pediatric ward. Even though children make up half of the facility's admissions, they say mixing children with adult patients is unsafe and hampers effective pediatric care, calling for urgent intervention to address the situation. Central Regional Correspondent Akwesi Ado has more in the following report.
The Kasoa Polyclinic serves more than 300,000 residents in the Otusenya East municipality and receives patients from Otusenya West, Gomua East, and Ga South. It is also a major referral point for motor accident victims. Yet, the facility has only 40 beds across its male, female, and maternal wards, and no dedicated pediatric ward, despite children making up half of all admissions. As a result, child patients are mixed with adults, a practice health staff say compromises care.
Unfortunately, we don't have a ward dedicated for pediatric care. Therefore, we mix them up with a female and a male adults. And that is the situation that we have here. And per our data, they form about half, 50% of the clients that we admit here every day. The treatments for pediatrics are different. It's quite different from the adults, male and female. And therefore, there should be even a pediatrician who should, a medical officer specialized in pediatric care, and nurses who are also specialized in that care, so that they'll be able to give that specialist care. But we don't have it here because we don't have the structure.
Administrators at the polyclinic say the need for a dedicated pediatric ward is now urgent.
We need a facility as urgently as now. 5 out of 10 admissions in this facility are children. And once we are having these numbers and we are having to mix them with the adults, use a very small space for them, the inconvenience and the breaches it brings in the quality of care delivery is a lot. So once this project is done, it's really going to make a difference. We are going to have a safe space to manage our children. We can even admit more children, and then we can be able to save more lives.
Otusenya East Municipal Health Director, Dr. Stanley Yeidu, says the municipality's 2 major public facilities, the Polyclinic and the Mother and Child Hospital, have a combined capacity of under 100. While the Polyclinic lacks a pediatric ward, the Mother and Child Hospital has only 10 pediatric beds, making expansion crucial.
We don't have a dedicated pediatric ward for the kids. And even when you go to Mother and Child, on a very busy day, the pediatric ward there is not able to hold the numbers that come. And so that is why this project is very important. How can you have a municipality as big as this and you don't have more than 15-bed capacity pediatric ward? It's an error. And so this construction of a 30-bed capacity pediatric ward is a very big step to make sure that we provide the service, the quality of care that our children need. In Mother and Child, we have a neonatal intensive care unit. It's a very small space. If you go and see, it's a very, very small space. And I'm hoping that apart from this children's block, going forward, we'll have a dedicated neonatal intensive care unit also at Kasoa Polyclinic. Because sometimes when the children are born, in the first 28 days, some of them have challenges, and we need a dedicated place to be able to take care of them.
Traditional leaders are also calling on government for immediate intervention.
Private hospital in fact polyclinic they are comfortable and no pay we na jude bia omo yedwuma te besra ban no so man ni nko na mo bia also de boa mo no hospital no otumi de aboa mo.
To address the challenge, authorities are constructing a 30-bed pediatric unit at the Kasoa Polyclinic. MCE said Sabasa Wonobanini tells ChannelOne News that several interventions are underway to expand access to quality health care.
By the grace of God, cut short for the addition of a pediatric block that will be adding 30 solid beds to what we have now. As we speak, the polyclinic is only managing 42 beds for over 25 years. This is one significant step that we have taken to help solve our health issue.
Children form half of the total admissions here at the Kasoa Polyclinic, but there is no dedicated ward for them. Management envisaged that the completion of this project will help solve some of the challenges associated with pediatric healthcare. For the ChannelOne newsroom, I am Akwesi Ado, Kasoa Central Region.